So one last point I want to bring up on the supply side is around a particular area we talked about before, which is mental health. This is an area that we have directories full of providers, and apparently it's kind of hard to get an appointment with a provider, particularly if you're a new patient. What are you seeing there, and where do we go from here? I mean, this is a big challenge, I think.
I'm thinking this is an area where telemedicine may have a role, at least in the short term, because you're right, the access is really hard. I think we use a pretty broad network, and we still hear all the time that there just aren't the providers there. And so this is an area that I think, at least for initial consult or some intervention or somebody to talk to, that telemedicine might be effective for mental health.
Yeah, I think this is your classic supply and demand. So you do not have enough mental health providers. Therefore, they don't have to be part of the networks. They can be out of a network and thrive and do well. And a lot of times it's easier on the practice. They don't have to hire as much administrative staff and deal with all the headaches of having to file claims, things like this. So first of all, there's not enough. And second of all, like you said, there may be a list of providers, but they may not be taking any more new patients with this plan. So I think I think we need to get more mental health providers, whether it's the reimbursement, things like that, but it's a difficult, much like primary care, difficult profession to get providers to go into.
I would completely agree, and I think one of the challenges is are they, as providers, being appropriately compensated for the services that they provide? They don't have procedures like a number of other clinical entities, and I think to a good extent that creates, I think, an incentive or is a limitation that creates an incentive for those individuals who want to be paid in parity with other individuals in the profession.
And this also relates to integration of behavioral health into primary care. Most of the prescription drugs that are being offered for a behavioral health issue are coming through primary care, and yet our primary care physicians are not trained in behavioral health typically, right? There were new codes established over the last few years, and Medicare is paying for them. When we did our deep dive, we found there's not a lot of claims coming through in that space. How important is it to get that fixed?
I think it's very important because as we talk about this in employer groups too, one of the solutions to taking care of lack of access to behavioral health professionals is sending them to primary care, and it's like you're already short-staffed there. It's like that's just not a solution at all. But I think for primary care providers, I think as they add a behavioral health individual into their practice, there's just such a wealth of support there, because not only somebody who may have a mental health condition, but as we were talking before, some of these people with chronic illness need that behavioral health counseling to kind of turn the corner, and I think it can make a primary care job much easier too.
The ideal primary care office would have behavioral health specialists and a nutritionist, all under the same group.
And I don't think we should discount, there's still a lot of solo practitioners or small practices, but we shouldn't discount virtual care in this. Right. That virtual care is the way that we can deliver integration even in small practices, but we have to have a will to help make that happen and push that through. So, but I do think to your point, interestingly, what I've heard from providers is that have gone to integrating behavioral health into their primary care practice is they will never go back. Yeah. Once they've experienced what it means to serve their patients effectively and comprehensively, they realize it's better for their patients and better for them. Yeah. It's all good. So I think that there's a lot of work to be done still in the medical delivery system. I think, you know, some of the central themes are that, yes, we need to look at payment reform. We need to look at delivery reform. We need to put more emphasis on primary care, and you know, the triple aim, quadruple aim still remains there. You know, we need to be able to differentiate on quality. We need to understand what costs are. We need to move away from fee-for-service, but also improve the patient experience and the provider's experience as well. So,
And Mike, to your point, I think it comes back to this central theme of patient-centeredness, that we need to meet the patient where they are. Simply providing clinical services isn't going to achieve the kind of success that we want to have.
Yeah, and the other thing too is, as we've been talking about the patient, you got the physician burnout issue too, and it's the lack of coordination. It's all these non-patient care administrative things that they have to do that just makes it less valuable to be a physician.
and this is where getting the industry to move together
Yes.
rather than independently would make a difference in everybody's lives, including getting the outcomes that I think employers are looking for.
Yes.